disc problems can cause severe back and leg pain and harms a person's quality of life. But there is help. Here with more information is Dr. Cecil Graham from AZ Pain Centers. It's good to see you, Dr. Graham.
It's good to be here.
You know, people talk about, a lot of people suffer from back pain. You hear bulging disc, you hear, and I don't know if we really understand what's going on back there, but if you have it, you just know you're miserable.
Oh, absolutely.
Most people are. And they think a lot of people think they have to just live with it. Do you get a lot of patients who come in going, well, my doctor said just got to deal with it?
It's the #1 presentation to a primary care physician in the United States. 27 million people.
Back pain?
Herniated disc.
What is a herniated disc?
We have a graphic that we can look at. Okay. This is pretty good. The top disc is fibrocartilage that attaches the vertebral bodies together.
So bone to bone?
Bone to bone,
okay.
and it attaches. In younger people in their 30s and 40s, there's a center part of the disc called the nucleus, and the nucleus is the consistency of jelly. And if you think about it, when you bend, most commonly, if someone bends forward, lifting something up, it's like pushing down on a jelly donut. If you push down on the front of it, you push the jelly out the back.
Oh, okay.
So see, as you look at the second, the one here that says bulging disc, it's just a tiny protrusion of the disc. The herniated disc is where the nucleus, the actual center of the disc, comes out.
It comes absolutely. Oh, is that what that little blue thing is?
Correct. That's what it is. And it not only causes a mechanical problem pushing on the disc, on the nerve root itself, but it secretes an enzyme that actually dramatically increases pain and the inflammatory response in that area. So you have two different mechanisms when you have the herniated disc that is putting pressure on a nerve or soft tissue anywhere in the area.
How do you know the difference if you have either or? Do you have to get an X-ray or MRI?
An MRI looks at the soft tissue so you can delineate it, but on physical exam there's a couple of classic signs that we see when we do the exam. One is called just a simple straight leg raise and you can do it sitting with the legs straight, but if you get that irritation and you get the shooting pain, we have another slide here.
The pain? Yeah,
right, right.
Yeah.
Now here this shows, you always hear the term sciatic.
Yes.
People say
all
sciatica.
The time.
The sciatic nerve is 3 different branches that come off of the spinal column, L3, 4, 5, and actually part of S1. So they come and so branches of those nerve roots form the sciatic nerve. Comes down the middle of the hip itself and then distributes all the way down to the foot. So any pressure on any one of those spots from a disc can give you pain in that entire distribution.
Oh yeah, you hear people say I've got the shooting pain from my hip all the way down. That's
exactly.
Probably the most common thing you hear.
The most common. We see probably the lumbar disc is 15 times more common to have herniation or bulging than the cervical disc. But essentially our treatment, we approach it the same way. You approach it with anti-inflammatory injections at the site where the irritation, so we actually go right to the site where that disc touches the nerve root. One other thing that was on that first slide that we didn't address is the layman's term, bony spurs.
Okay.
You've heard that term, a spur. It's an osteophyte. It's an actual bony prominence, and you can see here at the bottom.
Yeah.
As people get older, in their 50s and 60s, you start seeing extra bony formation. So that itself can irritate the nerve root.
Sure.
But the end result when it's touching a nerve root or putting pressure on that area is an inflammatory response. So what we do is we target it, go down with X-ray and place anti-inflammatory substance at that area. Part of what we do that's a little different is most commonly across the medical community, those injections are done with steroids. Mm-hmm. We do some steroid injections too, but most commonly we use a non-steroidal substance that essentially doesn't have a side effect profile. So you get the same anti-inflammatory treating at the cause of the pain as opposed to narcotics and things that just affect your perception of pain on the brain level.
Basically painkillers that say, here,
right.
We'll numb this area, but you're not getting to what's causing it.
Right.
You get right to the cause,
exactly.
Which will, in turn, alleviate the pain.
Exactly.
And get right to the root of the problem. Will this last, once you get the injections, will this last a long time, or do you have to come back sometimes, or it just depends on the person?
We do it in a series of 3 at 2-week intervals, and we combine that with aggressive range of motion stretching exercises. So physical therapy has to work hand in hand with it. But if you get We love to get these when they're acute, in the less than 6 months where the problem's been there. Then you have about a 95% chance with the injections combined with physical therapy of curing the problem.
Yeah, don't wait till it gets really bad. Go in. I think people think in order to see you they have to wait till they're in a lot of pain. It's like, no, go in now. Get to the symptoms. So then when you do your yoga or your physical therapy, you're going to get so much more out of it.
Right. What we do actually allows you to do the things that support the body to actually heal it and reabsorb that disc. It will actually reabsorb back away from the nerve root.
Interesting. Thanks, Dr. Graham. Really, I know so many people who suffer with this. So if you want more information about AZ Pain Centers, go to their websites, azpaincenters.com, or you can always call their phone number right there, 480-821-PAIN.